for them. And equally, you've got your contact with Sarah if you need anything, any other details that come through. This is going to be like a real broad overview of the BSc course that we run at Lincoln. We also run a Cert HE course in ambulance clinical technical practice, but you can see that if you go to our website, which is on there, or you can also follow us on Twitter, UOL_paramedics, that's in there. So this is like the who, what, why, where of our course. We last for 3 years. We're under the School of Health and Social Care, and it's taught in Lincoln on the Brayford Pool campus, which is a beautiful sort of lake area, which is right in the middle of Lincoln, and it's covered in swans for a lot of the year, which is why our crest that you can see at the bottom there has got a pair of swans on it. We're validated by the Hcpc, which we have to be in order to graduate paramedics, but we're also endorsed by the College of Paramedics. What you'll find is that all paramedic courses are validated by the Hcpc. Not all of them are endorsed by the college, though. If you're really keen, you want to go apply now, that's our UCAS code, B780, and the fees are fairly standard at £9,250 a year. Obviously, that's subject to government change. We take about 25 students each year. That sort of varies a little bit, and we use our technician course as well to sort of balance those numbers out to a certain extent. If you want to come and study with us, we will need you to either have or be predicted to get GCSEs at grade C or 4 or above or equivalent in English, Maths and Science, and a UCAS tariff point of 120, which is equivalent to 3 Bs. I put the access course stuff on there as well, but generally speaking, if you're coming straight to us from sixth form, we'll normally be admitting you via the UCAS entry criteria. And this is the sort of thing that we look for. I think it's important at this point to think about why you want to become a paramedic and why particularly you want to be a paramedic as opposed to a nurse or a doctor or something else like that. These are sort of the rough qualities that we want, and essentially we have to remember that this is a patient-facing role in its purest form. And when you graduate from our course, we will be expecting you to go out to be a generalist paramedic. That's someone who probably works on ambulances or fast response cars for at least the first year or two of your career. So to do that, you need to be a kind person, you need to be empathic, you need to be very noticeful of the environment around you. We want you to be very dedicated towards looking after the patients that you're going to encounter and be really motivated to help them. A lot of what we find in current paramedic practice is that there's a significant amount of pathways and referrals and things like that, which mean it is difficult sometimes to provide good quality care for the patient as you would want to provide it. So we need people who are going to really push the envelope and are willing to be imaginative, creative and persistent with getting some of those care pathways in place. If you think you're observant enough, then hopefully you've spotted the spelling mistake, and if you haven't, you need to crack up and revise up your observation skills. The way we'll look through your application, we look through all of our applications and to find out which ones we want to invite for interview. It's an interviews-based course, as all health professional courses are. We'll look for some kind of experience of health or care and some transferable skills on your statement. You'll come for a group interview. Currently, these are being held on Microsoft Teams. Whether that changes in the future, I genuinely don't know. You'll need to undergo a DBS check your criminal records, and if you're a non-native English speaker, we require proof of IELTS at grade 7 with no element below 6.5. There's also an occupational health check that you'll have to undergo. Again, that's the same as pretty much every other healthcare course that you'll find. And this is how we look for it. This is how we actually go through applications and work out who we want to invite for interview. When you're writing your UCAS statement, it's important to bear in mind all you're after doing is having us want to give you an invite to interview. That's the main thing that you need to be focused on. So we want your personal statement to be outstanding. Why can we demand things like that? It's really simple. We've had upwards of 500 applications for this course in the last year. So we can afford to be really picky about the people that we choose to bring to interview or not. So you need to make sure that your personal statement pops. It needs to sparkle in front of us. You need to outline what your experience is and preferably put something in there about knowing what a paramedic does. Now that may seem rather obvious, but actually a paramedic goes way beyond what we see on TV. It goes way beyond what we see on documentaries, and sometimes even goes way beyond what we might read in books. So you need to have a very good think so that you know within you why you want to be a paramedic and why it's this profession in particular that you think you'd like to embark on for the rest of your career. So you need to demonstrate this real passion for the profession and an underpinning knowledge of what you have. So by that, I mean not only what a paramedic might do day to day, but you might want to think about the history of paramedics. You might want to think about the development of paramedics. You might want to think about what's happening currently within the profession. There's lots of different resources you can go to think about what has happened in the past to paramedics and what might happen in the future. Whatever you say in your personal statement, you could do with evidencing and applying everything that you say to how that's going to help you on a paramedic course. And this is the big thing. It's written in bold at the bottom. We want to see how you embody all the knowledge and the skills and the attitudes and the qualities and the attributes of a successful paramedic. If one of your answers is simply that you want to help people, my response to you is simply, lollipop ladies help people. So do teachers, so do police officers. If you want to help people, there's loads of different professions you can go into. What we really want to know is why you want to help people by being a paramedic. The curriculum that we offer is offered over 45 weeks, so it's the long version of study. You'll need to know that if you're sorting out accommodation for yourself. And a large part of that is practical placements. Over the course of 3 years, I think it's about half and half that you'll do theory-based at the university and practical-based out on placement. And as I've already said, we're validated by Hcpc and the college. The actual role itself is different things to different people. And as we were saying earlier, sometimes it's difficult to exactly define, and sometimes we define what we do by the expectations of the people that we're talking to. So for the most part, I'm perfectly happy to describe myself to young children as someone who drives an ambulance. I'd be very, very upset if any of my professional colleagues thought of me as someone who simply drives an ambulance. So that's like a little sort of meme about what my friends think we do, what my mum thinks I do, which is cuddle cute babies all day. Society tends to think that we do a lot of sleeping in the back of stretchers. My boss certainly thinks that I've bent an ambulance or two. And what we actually do is see people in the very worst hour of their lives. Now, some people will be at the brink of life and death. They are few and far between. And about 95% of the work of a paramedic is not people who are at death's door. It's people who are in crisis. It's people who have been let down by the health service. It's people who have multiple comorbidities that need to be managed, and they need to be managed in an appropriate way. If you're simply joining this profession because you want to be exposed to car crashes and to trauma and to people who are bleeding lots, then you might be able to get that within this career, but it's by no means guaranteed. And there are students who graduate from our course having spent 3 years here who have never been to a serious car crash, who have never been to someone who is a workable cardiac arrest, someone who's stopped breathing. That variety of experience is certainly out there, but sometimes you have to be in the right place at the right time, or for the patient, the wrong place at the wrong time. This is a quote by a chap called Mark Reed. I think it's overused in a lot of places, but I think for this sort of environment, it's absolutely perfect. That you're not simply going to come here so that you can pass the test and wear a different word on your shoulder and because you look good in green. What you're actually here to do and what you're here to study is for that day when there's nothing else that's going to stop a patient from dying. And that's a really important quality to have. You need to have the emotional resilience and the motivation to stand there and do something to stop a patient deteriorating in the absolute extremest of circumstances. But I would go one step further than that and say that the other reason you're really studying is to stop people getting worse. And sometimes that's as simple as making an old person a cup of tea in their home while you wait for their carers. If you can't cope with that massive difference in jobs and that difference in pace, then this isn't probably the role for you. And we are criticised sometimes for the way we go about these presentations, is that it sounds like we're discouraging people from joining the profession. And actually, nothing could be further from the truth. But what I do want is for people to come on these programmes to really understand what the realities of the role are. And I think that's really, really important to get across. The placements that we offer you are all over the place. There's a real sort of Billy Basic map of Lincolnshire on there, and for your non-ambulance placements, so the ones that take place in hospitals, GP surgeries, that sort of thing, they will be, broadly speaking, within the county of Greater Lincolnshire, which goes roughly from the Humber in the north down to the Wash in the south. One thing you'll notice about that sort of map there is that Lincolnshire's only got one motorway, and it goes east-west at the very, very top of the map there, which to a lot of people isn't actually Lincolnshire anyway, but that's a different argument. It's quite difficult to get to places in Lincolnshire. We don't mandate that you have a driving licence or even a C1 entitlement on this course. However, it will be massively beneficial for you to have access to your own transport in order to help you with placement. You can see Lincoln, which is roughly in the middle towards the left-hand side of that map on the A15, junction of the A15 and the A158. If you can't read a map, it's really useful to learn. And the placement team will try and keep you within about an hour's commute of your place of residency. Now, if you're committed to public transport, that's going to leave you a very, very narrow area of operations for your placement. If you have got a slightly wider area of operations, then you can get a much better variety of the different placements you go on. And the various placements we go to are ambulance services, as you'd expect, every single year. Mental health services, you'll go to in your first year. Coronary care, some other different departments of the hospital throughout the second and third year, and accident and emergency departments as well. What we try to do is to give you a big variety of different kinds of patients, because as a generalist paramedic, it's likely that you will see a huge amount of patients who are what we'd call medically undifferentiated. They've got no diagnosis with them, and it's up to the first person that they see in healthcare, that's me and you, to actually work out what might be wrong with them. So what we need to do is give you as much experience in different areas of medicine as we can, so that you can apply that knowledge to when you see your next patient. This is roughly what you'll study. Unfortunately, I've been at a meeting today and we're going to rejig this a little bit, so it might not look identical to this if you were to come to one of our open days later on in the year or going on to next year, but we'll still be covering the rough areas what we'll do. And what most people are really interested in is the first year, level 4, over on the left hand side there. We start off with some fundamentals of anatomy and physiology and the essential skills that you need for paramedic science. After that, you move on to some interprofessional working and some behavioural science modules as well. And in clinical placement hours, you'll be going to the control centre, onto A&E vehicles and into mental health environments. That's probably what you're most concerned about now, what you think you might be doing in a few months' time. But I draw your attention to level 6, the third year of the course. And I think this is one of Lincoln's unique selling points about this, is that what we've essentially done is said at level 4 in the first year, we want you about the level of ambulance technician. At level 5, we want you at the level of a paramedic. And at level 6, we want you looking towards specialist roles, looking towards more advanced roles. So in there, you'll be looking at leadership and research and some advanced skills, things like wound closure and some more advanced joint assessments that you'll be doing on the third year. And for that reason, in the third year, your placements will be in minor injury centres, in GP surgeries, sometimes district nurses, incontinence teams, anything like that, that might add in an extra layer of knowledge, which becomes the deciding factor if you decide to progress somewhere else on your career. Sometimes we have people who don't want to engage in that sort of thing. That's up to them, but at the end of the day, we write the course and it's us that says who passes or fails. And what I can say with absolute certainty is that this course is written by and run by paramedics. We know what new paramedics need in order to give them the best start in their career. And this is something that I really wish that I'd had when I first started. I think it's worthwhile saying as well that if you were to go right now, if you were to graduate from our third year and go straight into a job with East Midlands Ambulance Service, which is the local ambulance service, the leadership and practice education module would be enough to secure you a clinical mentorship portfolio with EMAS and increase your pay band within 6 months. And normally that process would take about 2 years. So that's something that we're really proud of. That we can map across. It may well be the same in different ambulance services as well, we're not really sure. But with the local ambulance service, that's what it's been designed to do. The way we assess you, in theory, we've got different ways of assessment, as you'd expect. We do some multiple choice questions, some exams, some essays, presentations. We'll ask you to write a reflective journal, and we teach you how to write in a reflective manner because there's a certain skill to it. And then the last thing in the research project is we'll ask you to do a service transformation project. In practical terms, everything is assessed against the Hcpc competencies. The Hcpc is a phrase you need to get used to knowing. If you stand a chance of getting an interview on a paramedic course, you will definitely need to know something about the Hcpc. You will have a clinical assessment portfolio, which at the moment is a ring-bound book, which makes me feel a little bit nervous because I don't like the thought of it getting lost. But it's a complete portfolio with all your proficiencies in, and you get 3 of them, 1 for each year of the course. And at the end of every year, you'll have every page signed, you'll have all the competencies signed off. At the end of the 3rd one, once you've passed that and your theory assessments, then you're eligible to register as a paramedic. We also use OSCEs, which are objective structured clinical examinations. It's a practical exam. It's essentially a scenario where you come into a room with me and maybe a mannequin, and we ask you to do something on that mannequin. It's exactly what you'd expect. The other 2 forms of assessment I've written up at the top, slightly tongue-in-cheek really, and yet they're the most important ones. They're the ones that I felt I'd achieved most when I knew that I'd passed them. And the first one is the 12-hour test. A standard ambulance shift is normally 12 hours long, 7 till 7 is the standard one around here. And that can be a long time in an enclosed space with another person. And that other person at that time is everything to you. If you don't get on with that other person, or if that other person has an abrasive personality, or a laugh that you find annoying, or an accent that you don't understand, it can make that 12 hours seem really, really long. If, on the other hand, the person you're spending time with is good at their job, has a good sense of humour, and is perfectly nice to rub along with and get along with, then the 12-hour test is passed. And what I look at a lot of our students is, and I say to myself, would I want to spend 12 hours in a van with them? Because that's what an ambulance shift is. And the other one is the family test. I live in Lincolnshire, my family lives in Lincolnshire. If I graduate a paramedic from Lincoln, I don't want to be thinking and be worried that that paramedic's going to turn up at my family when they've had an emergency. What I want to do is to be relieved. I want to see one of my graduates treating one of my family and think, thank goodness for that. If you don't meet that test, it's unlikely that you'll pass, because all of us live in Lincolnshire and all of us have a commitment to the patients that our students and our graduates will go and see. And it's really important to us that we think you're fit to go out and look after people, because that's what we're all here to do. And even as an educator, I still have a responsibility to patients that my students will go out and see. In terms of your employability then, it's dead easy at the minute. In 3 years' time, I can't see it getting much better, if I'm totally honest. I think it will be dead easy to get a job as a paramedic. I think if you do a quick and dirty Google search right now, you'll find about 200 vacancies in the UK for a paramedic. And some of those vacancies, particularly if they look on the NHS job site, there'll be a single job advert, but they're actually advertising for a team of people. So there might be 13, 14 vacancies behind that individual job advert. And they're in lots of different areas. Now, if you're fussy about where you work, you're going to want to pay a lot of attention to that careers framework that's on the left there. Because that careers framework sets out the qualifications and the barriers to each different stage of moving up the ladder in paramedic practice. So we graduate all our students in clinical practice. So you start off as a paramedic, which is now a degree-only entry discipline, and rightly so. But it's quite easy to progress in each one. If after a few years you might like to go into being a team leader or a tactical commander, or whichever one the role that the ambulance service is using this week, you might well then shift over to the right into that management area and become a team leader or a paramedic there. Bear in mind, as a paramedic, you've actually got a responsibility as managing and educating in that area as well. If you look in the education area, I'll give an example of myself. I practice clinically still, and I practice at a specialist paramedic level. In education, I'm at senior lecturer level. I've got my master's and I'm moving towards principal lecturer in a few years' time, fingers crossed. But I'm still a research paramedic in my research activities because I'm still quite new into research. And so far, I've managed to completely avoid being a manager. The different areas that you can work in, our minds naturally go to the NHS, and that's who provides the majority of our placements on the course. However, there's lots of different areas. Now, I just pulled this list off the top of my head when I was putting this presentation together. You can go into lots of different areas as a paramedic, but I've got friends who have worked as paramedics in every single one of those areas and a bit more. I've also put on, because we're immensely proud of them there, that was our very latest and our first, in fact, cohort of graduates. They're not all there because COVID meant that they couldn't have the graduation ceremony on time, but there they all are. The ones in blue are our graduates, and the ones in red is our lovely course leader, Sarah, on there. And you can see there, if you wanted something to aim for, the graduation takes place in Lincoln Cathedral, which is a huge Gothic building, and then across the road into the castle. And that was taken outside that lovely sort of copper beach that sits in the castle grounds. And the graduations are absolutely lovely at Lincoln. They're properly good. So that's pretty much it from me. You can go on that website, and it will tell you all about our courses. You can tweet us if you want to. And if you follow the QR code that's up there in the top right corner, you'll get to our website, which will tell you all about the open days that we've got coming up. The next one now, I think, is in July, but have a look on the website, check in, and you can book your place there as well. If you are going to come see us, it'd be really great to see you, and it'd be lovely to meet you in person.
John, that's fantastic. Thank you very much indeed. A very comprehensive and straight talking, which I think is appreciated, kind of resume of how the course works and the qualities. I have got a few questions afterwards, but I wondered, Sarah, if you want to add anything at this stage, just to the presentation itself, and thinking that our students, obviously here in the West Midlands, we want to attract them to the best courses. And I just wondered, as sort of in your outreach capacity, if you might want to just talk for a moment before I ask some questions, if I may, directly to John about the course itself and some questions I've got.
Absolutely, and thank you, John, for that. And the only thing I wanted to add, and I'm sure John will support me on this, it's so important that you present a balanced UCAS personal statement, because we do operate a scoring system. And 50% of what we're looking at in your personal statement relates to work experience, and 50% relates to your understanding and passion that you can show for the role and the career that you are applying for. So it is really important that students start to think quite early on about that work experience. It's not just enough to do 2 weeks in a primary school or 2 weeks in a care home. We're looking for students that have got a little bit of a longer term commitment to that work experience. And we don't care whether that's voluntary or paid. It makes no difference to us at all. And in some ways, voluntary work indicates a greater degree of dedication to that. And it can be anything, but it needs to relate to health and social care of some description. But we certainly need to show, we need students to show that they've got some sort of longevity of that work experience, not just a short block linked to a programme of study, for example. So if that might be helpful.
I think that's very helpful, and encouraging our students to take up work experience in the sector has been obviously a little bit complex in the last couple of years, and our students have been, if you like, transitioning from secondary school to A-levels through a pandemic, and also their first year at college pretty much through a pandemic. So what we have been encouraging is very much, like you've said, the volunteering with people like the St John's Ambulance and some of those sort of organisations. Is there anything, John or Sarah, that you think would be particularly helpful and demonstrate not just the initiative for students to go and volunteer, but perhaps some of those little practical skills that you were talking about, John?
A lot of this for me is about talking to people, and that's something that's really important. So we do want healthcare experience of some kind, some way of description, but I think as well, if you work in a pub, for example, I think working in a pub is a brilliant way to get into healthcare, because you've got customer service experience, you know how to talk to people, you'll likely know how to talk to people in a variety of different states of consciousness. There's lots of different things that come out there. So the same with retail work. So I'd say don't, particularly if you've got students, and I'm really aware of this, students who perhaps need a part-time job as opposed to wanting a part-time job to go on. I'm really conscious about not going so far down that we love, because if you can talk to someone, if you do customer service, then the chances are you'll be pretty good moving over into a healthcare role. So maybe that part-time job in a shop, as well as the work experience that perhaps you provide, Louisa Fair, I don't know, that might be quite an interesting sort of angle. Absolutely. And there's no situation that a paramedic will never face. So you can normally twist most scenarios round to something that's relevant.
And I guess for a paramedic, they're, if you like, the buck stops with the point at which they encounter people. So that skill is the key skill, in addition to obviously the dexterity, all the things that go with the actual role itself. So that's really, really helpful. And also, I think you talked about, participating in mental health in the coronary and A&E. And I think it's understanding the variety of placements that they will encounter and the environments that they will be expected and want to have engaged in, potentially some of it before, but certainly during the course as well. So that's really helpful. Thank you.
We want students that can show a variety of transferable skills, really. That's what we're looking for. So it can be lots of things that they're doing even now at school, sort of roles where they're sort of mentoring younger students or taking part in responsibility within the school environment, or even taking part in things like Duke of Edinburgh award schemes where they're showing different skill sets for different elements of that programme. They're the sorts of things, if they can sort of layer lots of these particular endeavours and experiences, that makes for a really good personal statement.
That's really helpful, thank you. About the A-level subjects that are required to get onto the course, can you talk a little bit about sort of ideal subjects or necessary subjects in terms of A-levels?
We don't really have any.
No, we don't.
If you've got A-levels in German, ballet and art, we'll still, if you meet the grades, if you meet that intellectual rigour, then we'll still, because there may well be a paramedic out there who's gone to a German-speaking artist ballet dancer who's hurt themselves, so there's never really, so I think it lends itself more to people who've done sciences and psychology maybe, or sociology and that sort of thing. But I wouldn't say to anyone that they should be put off if they've not got a background like that. The anatomy and physiology stuff and the hard science stuff in the first couple of years is pretty tough. And it sorts the wheat from the chaff quite a lot of the time. But I think so long as you've got the dedication, the perseverance, and those intellectual skills, you've been able to get your 3 Bs at A-level, then we'll be able to sort something out for you.
That's brilliant. Can I just ask as well, we had a question about if I wanted to be a paramedic in the armed forces, what route would I take? And you talked about military, I know, at the end as a possible option. Can you talk a little bit about whether the armed forces is the right place to go first and how you go through that? Do you have any?
It all depends. Generally speaking, if you want to be a paramedic, then your best bet is to come and be a paramedic first off. If you want to be in the armed forces, then go and join the armed forces, because each branch of the armed services has their own way of training up there. In the army, it'll be a combat medical technician. In the Navy, it's a sick berth attendant, and in the RAF, it's something else I can't remember. But they all have their own little flavours, and they are normally short of a paramedic in terms of civilian practice. In warfare and in military times, I mean, my brother-in-law is actually a diver, or was a diver in the Navy, and he was taught to suture and wound close, and I can't do any of that. So there's bits of it that are greater than that. The Navy and the RAF do sometimes put military personnel through a civilian paramedic program. It's becoming less rare now because we've got degree-only entry. It's becoming far more complicated for them to do that. But one of the issues that they're having with that is that for some roles they do need a paramedic skill set, and then they're looking to the reserve forces. So I had someone a few years ago try and recruit me into the RAF, quite hard, sort of, and there are many reserve elements of particularly Army and the Air Force that would love you to join as a paramedic, because they will be able to utilise your skills almost immediately. Less so with the Navy, because the Navy is a bit more remote medicine focused. They use a lot more doctors than anybody else does. But as a reserve occupation, it's really, really interesting, because there's lots of help for reservists at the moment.
Right, that's excellent. Thank you very much indeed. And you talked a little bit about fitness and obviously in terms of recruitment and that onto the course. What sort of level of fitness needs to be provided?
We have no requirement of a fitness test. You have to do your occupational health screening, which will work out if you have any sort of bleeding disorders, any prone to any infections or anything like that. But I think it's worth pointing out that it is quite a physical job at times, and at times you will need to be fit for the job, and the job won't keep you fit. You have to go and do that for yourself. But at the same time, it's a good idea just to stay fit and healthy anyway. You know, if it shouldn't be part of your career plan to grow a spare tire in middle age like I'm doing at the minute. So yeah, anything that you can do would be beneficial. And if you're looking to go into different roles with the ambulance service, such as the hazardous area team, which a lot of people quite like the idea of, it's really quite useful to build up your aerobic fitness for doing things like that.
That's great. And one other question, and I'm not sure how you will decide to answer this, but the student paramedic role that is obviously advertised certainly through our local ambulance service and as a national programme, I know. Can you talk a little bit about the merits of the two routes? As a student paramedic, you must have a very particular view on that, I'm sure, but can you just kind of give a bit of a balance on that?
I don't know the exact ins and outs of the way West Midlands do it. I know that West Midlands Ambulance Service is a university NHS trust, yeah. And you have to have a degree to be a paramedic now. This is the year that begins in earnest. From my point of view, my experience with the NHS and the ambulance service, which is generally East Midlands, Yorkshire, and a little bit east of England, so almost entirely around West Mids and not near West Mids, I'm really sorry. But my experience from them is that their operational requirements will always come first. So you may join as a student paramedic, you'll be an ambulance technician for a period of time. If their operational requirements demand more ambulances, then they will pull you from your paramedic training and they will stick you on an ambulance, and that will always be their overriding default setting, I suppose, if you like. One thing I'll say in favour of the West Midlands course is that it's very well established now. The other ambulance services I've worked with in the past have had quite sort of sporadic attempts, which means that you'll get one cohort of student paramedics and then someone else will go through, it'll be a slightly different course name, which means that there's no uniformity to it and no one really knows what to do with it. Generally speaking, it's a faster process to come to university. You spend 3 years here, you leave as a paramedic, end of. And I probably shouldn't say this, but that applies to any of the universities in the UK. If you turn up on day one, keep your head down, work hard, 3 years later, they'll spit you out as a paramedic at the other end. And that's regardless of whether it's Lincoln or Hull or Teesside, wherever you go. I think if you go to the West Midlands, it might be a competitive process to get on the next stage of your training. It could be that there isn't enough room to get to the next stage of your training, and that's going to elongate everything out. You are getting paid and having experience in that time, but experience on ambulances is becoming rare. And one of the issues we're having at the moment, we've all seen the papers about handover delays at hospitals. I've got students who are seeing 2 patients in a shift because they're spending 8 hours queuing outside a hospital, which is really, really damaging. And as a student paramedic with that, if that happens to one of my students, I've got to sort something out. I've got to sort out simulations and do different things so they get more experience. A student paramedic in West Mids Ambulance Service doesn't have that opportunity. They are your hours, and that's what you've got to do. So yeah. I would say university is the best way, wouldn't I? Because it pays my mortgage. But but also it depends how quickly you want to do it, and if you're in a position where you can afford to go and get the student loans and that sort of thing. Yeah, that probably doesn't answer your question at all, Louise. I hope that helps.
Yeah, it does. I think that's talk. Actually, I think that's kind of really helped get to your opinion is obviously as well based very much upon seeing students go and benefit from the university route and take that on board totally. And I'm kind of gauging as well that some of the key skills for students to really kind of look at here are the resilience. I'm also only week before last encountered with a family member a paramedic situation, and a good sense of humour I think is probably also a prerequisite. I'm sure you would agree with that.
Quite a dark sense of humour as well.
Yeah, I guess so.
Even, I mean, Sarah's nodding there. We're known even amongst healthcare professionals of being a pretty dark bunch. Yeah,
absolutely. And I think that the words that I wrote down that you said about 95% of the work is about people in crisis, and I think it's, you know, sometimes the slightly glorified view of a paramedic. And what they fundamentally do is something you really well explained, and I hope that students will take some of that on board and dig deep to find some really good reasons for becoming a paramedic, not just a glib sort of reference to it. So thank you very much. I didn't have any other questions that students had asked in advance, but those have been really helpful. Thank you. Sarah, I don't know if there's anything else you'd like to add, but Faye and I were saying that in actual fact, we have an event coming up that we might be delighted for somebody to attend, whether it's yourself or both of you. I'm not quite sure how you do that, but we would very much, I think, like to invite you to come to the college and speak to perhaps a number of students in face-to-face circumstances where we can get that message over. But we're delighted today that you've joined us, so thank you very much indeed. We shall.
Thank you. By all means, let me know of dates, Louise. That'd be lovely. And our next open day, as John alluded to, is the 9th of July. So it's a Saturday. And then we've also got another one on a Friday, the 8th of July, which again, students are welcome to come to. But you can book that via our university website. You can book a place on there, and then that confirms, and you get all the information then about how to get there, etc.
That's lovely, and I think there's no substitute for students visiting both the Lincoln itself, the university, and also speaking to obviously people like yourself, John, who can kind of speak with great experience of the course and everything. So we shall promote that to students. Lovely. Thank you so very much indeed, both of you, and we look forward to being in touch.
Yes, lovely. Thank you, Louise. Thank you. Thank you, Faye. Bye-bye. Bye, John. See you again. Bye. Bye-bye.
Bye.